With the approval of multiple CGRP monoclonal antibody therapies, many have asked how to switch a patient to Galcanezumab from another CGRP monoclonal antibody for migraine prevention. Information on switching to Galcanezumab has not been systematically studied. Galcanezumab is a CGRP monoclonal antibody approved for the preventive treatment of migraine in adults. It is self-administered once monthly as a subcutaneous injection. The approved dosage is a 240 mg loading dose as a one-time only administration, followed by monthly doses of 120 mg. Galcanezumab has been studied in 4 double-blind, phase 3 randomized placebo-controlled studies for the preventive treatment of migraine in adults. Evolve-1 and Evolve-2 in patients with episodic migraine, Regain in patients with chronic migraine, Conquer in patients with episodic or chronic migraine with treatment-resistant migraine. In all these studies, patients received the 240 mg loading dose followed by 120 mg monthly. In Regain and Conquer, patients who completed the double-blind phase were eligible to enter an open-label extension study. In Regain, all patients received a Galcanezumab 240 mg loading dose upon entering the open-label extension. In Conquer, those patients previously assigned to placebo received an initial loading dose of Galcanezumab 240 mg in the open-label extension study. Pharmacokinetic modeling of phase 1, 2, and 3 studies showed that the 240 mg loading dose achieved steady-state Galcanezumab concentrations by month 1 for the 120 mg monthly dose regimen, while the 120 mg monthly dose without a loading dose did not achieve steady state until 4 to 5 months. Patients were excluded from phase 3 study enrollment if they had prior or current exposure to Galcanezumab or another CGRP monoclonal antibody. Therefore, there's no data regarding whether a washout phase is necessary between 2 anti-CGRP monoclonal antibody treatments. Adequately powered, prospective, controlled clinical studies have not been done to examine the efficacy and safety of switching to Galcanezumab from another CGRP monoclonal antibody therapy for the preventive treatment of migraine. Clinicians are encouraged to use their independent clinical judgment to determine whether an individual patient is a candidate for switching. Decisions regarding the optimal time between taking one CGRP monoclonal antibody and switching to Galcanezumab are best determined based on clinician and patient agreement that takes into consideration the patient's situation, needs, and preference.